Hello, all. Do we have, sorry. Yeah. Good afternoon, all. This is Emily from Team Mass Creative. Thanks for joining us today for our December Artivist Town Hall. We're going to take just a beat before we get started to let folks in. If you feel so inclined, feel free to use the chat to introduce yourself, where you are zooming in from today, and how you fit into the arts and cultural community of Massachusetts. And we will get started in 3 minutes. Okay, I'm gonna get us started. Um, Welcome all. Thanks for those of you who introduced yourself on the chat. Can we take down the slides for just a second before we get started? Thanks. Um, so before we get started, I just want to share with our guest speakers today. I want to just give a little quick update on and refresher on where we are sort of in the legislative session world, right? Because that's one of the things on the state level about advocacy that we want to make sure that you all are updated on. So first of all, many bills are that have been had hearings are now sort of coming out of committee, and we're getting reports out of committee. We expect to know about the three bills that make up the creative sector agenda, hopefully very soon, both on the House and the Senate side. And as you know, right, bills get reviewed by a committee, then there's a decision made whether they're going to continue to move forward in the process or whether they kind of get stalled out in committee. We're crossing our fingers that they all get reported out favorably, because if that happens, most likely they will get sent to one of the sort of bigger committees for an additional review. And that's where we need all of your help to really push and advocate to make sure they get past this session. And we'll do more conversations about that leading up to, here's the announcement. Creative Sector Advocacy Week will be March 2nd through the 6th. and we will do our annual day at the State House on March 3rd. The last 2 years, we have had an amazing turnout of artists, creatives, and cultural leaders. We've been really lucky. Both the governor, the lieutenant governor, and the co-chairs of tourism, arts, and cultural development have joined us for that day. So I'm really hopeful you all will join us and save the date. In addition to the day at the State House, we're looking for folks who are interested in working with us to do local activations across the Commonwealth throughout that week to get people involved, to raise the visibility about the value of artists and creatives and cultural organizations in every nook and cranny of the Commonwealth. That's also where we will be doing a big push on a lot of our bills. The other thing we will be doing is we'll be talking about the budget, right? So in January, the governor will release her budget, right? And this sort of kicks off the annual budget process. Um, we are hopeful. I think if you have been through reading any of the news, you will know that things are really tight. And we'll talk a little bit more about this later on in the call, but due to decisions on the federal level, there is a lot of money, federal money, that is not coming into Massachusetts that will affect people's ability to access health insurance, access food security, the list goes on and on. And so the Commonwealth and leadership are going to have to make some really difficult decisions about how they spend revenue this coming year to try to make up for some of that, as well as continue to fund the work that they're doing. So we have been told that a level budget for any line item should be seen as a win. We are still in conversations with advocates and champions in the State House, as well as with the Mass Cultural Council and others, to figure out what feels like the appropriate ask this year. And we are excited to share that with all of you once we're clearer on that. Whatever the governor puts out, right, then it's going to move to the House. And then after the House debates their budget, it moves to the Senate. And then the Senate debates their budget. The two versions have to get reconciled. And this whole process will take us through June, probably July, right? If we're being honest, okay? So we know that we are going to need all of us to share and reach out to our elected officials, particularly our members of the legislature, to remind them that this is something that matters, that public investment in arts, culture, tourism, and libraries matters right now, and that our sector has been hit by federal cuts and clawbacks just like every other sector. So we are excited. The team, Kelsey, Richleen, and Nisa and I are excited to work with all of you to make sure you have the information and the resources and tools so you can feel confident in your advocacy. So that is a look ahead. But before all of that happens, it is enrollment period for health insurance, right? This is a big deal. And we are really glad that for at least the second year, I think, or no, 3 years, we've been doing this. We've been having conversations and have had folks from the Health Connector, which is our state's health insurance marketplace, join us to share what the process is going to look like this year, give updates, make sure that you know how to navigate the system, and then also so that you can share this out with your networks, right? Artists, cultural workers, creative arts administrators, right? Many of us need health insurance and many of us get it on the open marketplace. And this year, there are some changes. So let us brace ourselves, but we have two excellent folks to walk us through the process. We have Nikki Conti, who's the Director of Outreach and Education for the Health Connector, and Thalia Mercedes, who is the Communications and Outreach Associate, who are going to join us and I'm going to turn the presentation over to them both. So Nikki and Thalia, thank you for joining us today. And I will go on mute. I'm excited to hear what you have to share.
Thank you, Emily. And again, thank you everyone for taking time out of your day to hear about information from the Health Connector and specifically this year's open enrollment. Emily was right. Unfortunately, there are lots of changes, so lots of nuances. We're going to step through all of that information with you, and hopefully you'll leave today's meeting just feeling much more comfortable in knowing what next year could look like and what your different options are for coverage and ways in which you can shop and save money. So I'm going to hand this over to my colleague, Leah, and let her take this away, and I'll jump in as well, maybe midway through. Thank you all.
Thank you, Nikki. Okay, so Like Emily was saying, in our presentation today, we'll give a brief overview of who the Health Connector is and who we serve. We'll also go over some enrollment periods and the deadlines, how to apply and update your application, updates and eligibility for our connector care coverage, how to save on your monthly premium, and then where to get help applying for coverage and other resources that are available to help select the right plan for you. Okay, so what is the Health Connector? So for those of you who are less familiar with the Health Connector, we are the state's health insurance marketplace for individuals and families and small businesses. And we provide access to affordable health insurance. Those who shop for coverage with the Health Connector are usually those who can't get insurance through their job, their spouse's job, or if they have a part-time job that does not provide health insurance to their employees. The focus of our presentation today will be health insurance for individuals and families, but we do also provide dental insurance, and some of the plans available through the Health Connector have limited vision benefits, but members should reach out to the carriers directly to see what exactly is covered in their plan. Also available through the Health Connector is Health Connector for Business, where small employers can shop for both health and dental coverage for their employees. Today's presentation will not cover any details on Health Connector for Business, but if this is something that you are interested in, we host a separate quarterly webinar, and there's one coming up, I believe, on the 17th of this month, and we can share that information if anyone is interested in that. So when shopping through the Health Connector, you can be assured that all plans meet state and federal standards of coverage. When applying for insurance through the Health Connector, you'll choose from a variety of plans. Sorry, got lost there for a second. And because these Health Connector plans are on the state's marketplace, we have benefits and programs that can help reduce your monthly premiums. So first we have advanced premium tax credits, which we'll go over in more detail later in the presentation. And then we also have our connector care plans that are unique to Massachusetts and is based on an individual or family's income level. So those eligible for a connector care plan may qualify for low or no cost health insurance. And we will also talk about connector care plans and the changes that are coming to that program later in the slides. So on this slide, you will see all the health insurance companies in Massachusetts that offer plans through the Health Connector. All insurance companies who participate in the Health Connector also offer plans in our Connector Care program, which just means more options for Massachusetts residents. In this slide, you'll also see the dental carriers that offer plans through the Health Connector. If you have health insurance elsewhere and are just interested in dental coverage, you can purchase plans for yourself and your family through the Health Connector as well. All right, so now we'll just go over some enrollment periods, some key action items, and deadlines that you must meet for coverage. So there are two important timeframes to keep in mind when applying for coverage through the Health Connector. One is our closed enrollment period, where you'll need a qualifying life event to apply for coverage. And then the second is our open enrollment period, which is currently happening. During our open enrollment period, new and existing members can apply for new coverage or renew their coverage through the Health Connector. Open enrollment for plans that will begin in 2026 will begin on November 1st and run all the way up until January 23rd. So during this time, you'll have the opportunity to review the plans available on the Health Connector for coverage that will begin on January 1st. Existing Health Connector members will have the opportunity to review these plans as well as select a new plan if they would like. If anything has changed, if they need a new provider and they need to change their network or anything like that, now would be the opportunity for them to go back in and reshop for a plan that works better for them. The Health Connector coverage will also will always begin on the first of each month. So for anyone seeking coverage that will begin on January 1st, you must select a plan and make a payment by December 23rd. I also want to say this because some people are looking for coverage that starts sooner than January 1st. And in some cases you can do that, but you must have a qualifying life event. Anyone else who is just shopping regularly through open enrollment period, your new plan will begin on January 1st and you will remain in your old plan until then. Okay. So we often get questions about COBRA, so I wanted to take a few minutes just to discuss the Health Connector as an alternative to COBRA. Usually, if you are enrolled in COBRA coverage outside of the open enrollment period, you would need to remain in that COBRA coverage until you have a qualifying life event. Your employer, things that count as a qualifying life event could also be your employer stops contributing to your COBRA coverage. This information is not really relevant at the moment because we are in our open enrollment period, and anyone seeking coverage right now is encouraged to apply and explore their options. All right. So when you apply for coverage on mahealthconnector.org, the application is available in English, Spanish, and Portuguese, if that is your preferred language. The Health Connector and Mass Health use a single application to determine which coverage you might be eligible for. You do not need to know which one you are applying for, as the system will make that determination once you enter all your information. And if you have filled out an application with us in the past, please don't make a new account. Instead, call customer service and they will help you access your account. Okay. So as I previously mentioned, both new and existing members can shop for coverage during this open enrollment period, and those new plans will begin on January 1st. But the process might look slightly different for new applicants and returning Health Connector applicants. So we'll start with existing members. Our existing members already getting coverage through the Health Connector do not need to complete a new application. You just have to log into your account and make any necessary updates, including income changes or changes to your household size. You'll then review your eligibility and provide any document proof if they are requested from you, and you'll have 90 days to submit these documents. And lastly, you will select a plan, pay your premium if you owe one by December 23rd, and then your plan will begin on January 1st. So for our newly applying members, the only difference is here that you must complete a new application. You might be required to provide some document proofs, and you'll also have to make a payment on the 23rd for your coverage to begin on the 1st of the month. So there are a few qualifications you must meet to get coverage through the Health Connector. You must live in Massachusetts. You must be a U.S. citizen or be lawfully present in the U.S. You cannot have or be offered health insurance through your employer. And you cannot have access to public health coverage like Mass Health or Medicare. And I think this goes without saying. Oh my God, what's going on? Sorry, guys. This goes without saying, but you cannot be in jail and receive this coverage, but it's on the side, so I just want to go ahead and say that. Okay. So for our newly applying members, when applying for coverage, you'll need the following information: Social Security number for everyone who is applying, immigration documents for those applying, and then income information, including copies of your pay stubs, net income for those who are self-employed, and then your monetary determination if you are receiving unemployment. If you don't have all this information at the time of your application, that's all right. Just provide us with the information that you do have, and then we will follow up requesting any additional information that we need to get you covered. So one of the questions that we get often is what to include as income when reporting on your application. On this side, you'll see what sources should be included and those that should not be included. This information is also available on our webpage if you would like to review it. Additionally, it's important to keep in mind to keep your application and your income up to date to make sure that you get the right amount of help paying for your coverage and lower the risk of owing money to the IRS at the end of the year. When you are filing your taxes, you can log in at any time and update your income information, not just at the time of completing your application for the first time. Okay, so as after submitting your application, we ask that you check your mail from the Health Connector and Mass Health to make sure that no additional information is being requested from you. Any documents you owe can be submitted online through our website within a 90-day time frame. It's also important to keep your application up to date. So this will ensure that you and your families will get the right amount of help paying for your health and dental insurance and lowers the risk of IRS debt during tax season. And then this is especially important for those receiving tax credits. So if you would like to adjust how much tax credits you receive, you can do so at any time by visiting the health plan page and clicking Change Tax Credits. And now I will pass it over to Nikki to talk about connector care and eligibility and updates.
Thanks so much, Dalia. And I see that there are some questions coming through in the chat. We'll definitely get through a few more slides and then step through all of those. And hoping as we go through the slide deck, some of your questions are being answered. So in terms of the Connector Care program, I just want to orient those of you who might be less familiar. One of the advantages of coming to shop through the state's marketplace at the Health Connector is that you can, in fact, access advanced premium tax credits. So as artists, as I know some of you may be self-employed while others work at smaller organizations, you might not have access to employer-sponsored insurance. So if your income is fluctuating up or down during the year, through the Health Connector, when you are applying, you may in fact be eligible for advanced premium tax credits, or you may not be. And then if your circumstance changes, you can come back and report those changes to us, and you may find that you then become eligible for advanced premium tax credits. So I just want to be very clear about, we've been asked that question before, like, what would be the benefit of going directly to a carrier versus coming to the Health Connector? And truly, I think one of the biggest advantages is the fact that because we're looking at someone's overall situation and their household, you may in fact be eligible for some savings throughout the year. So these savings come to people in the form of these advanced tax credits. The way in which it works, it simply lowers the premium amount that somebody pays each month. Once you choose your plan and you've enrolled in that plan, the IRS sends your tax credit directly to the insurance company. So as you as a consumer, there's no administrative thing that you need to do there. And then, of course, if your income, you know that your income might fluctuate throughout the year, you have the ability to adjust the amount of the tax credit that you want to take. Now, the Connected Care program is a program that is unique to Massachusetts, and the way in which we keep the savings there for consumers is that we combine the federal tax credits that someone is eligible for with state dollars, and together that reduces the monthly premium. And also, the plan design really includes very low out-of-pocket costs and no deductibles if someone is, in fact, eligible for the Connector Care program. Now, we mentioned at the outset that as we look at 2026, there are a couple of changes coming to our program specifically due to federal policy updates. So, there are really two major impacts that we are facing for this coming year. First is that Plan Type 1 for the Connected Care program is being eliminated. So essentially, if someone is an individual or family and their income is under 100% of the federal poverty level, they're no longer going to be eligible for advanced premium tax credits and therefore not going to be eligible for Connector Care Plan Type 1. That particular segment of the program is going away beginning January 1. In addition to that, I'm sure many of you are fully aware that we just went through a government shutdown. And one of the negotiating chips was really around enhanced premium tax credits. So during or just after COVID, as part of the American Rescue Plan in the Inflation Reduction Act, there were additional dollars available to people through enhanced premium tax credits that essentially gave more people more dollars towards their health insurance coverage. So those were the enhanced premium tax credits really are the dollars that were being negotiated. And unfortunately, there hasn't been a resolution as of yet, although government has opened back up, the federal government. Those enhanced premium tax credits are still, um, we haven't gotten them back. So because of that, that also makes some modifications to the highest tier, our Plan Type 3D members. Um, so those tax credits are set to expire at the end of 2025. I know this might feel a little bit, well, this is nuanced. I shouldn't say feel. This is nuanced for individuals because I think when people were hearing about tax credits in the media, people just assumed all tax credits were going away. We're going to show you very specifically where and how these modifications will impact Massachusetts and Health Connector members. Now, because things feel like they just, keep changing, may change over the next couple of weeks, we still have time before January 1. We wanted to just make sure everyone is aware that we do have a webpage on the Health Connectors website, and you can access it by going to mahealthconnector.org/updates. And we are committed to making any updates as they become available to us. Once a policy has been finalized or if something has changed, we will update that location. And we're trying to update it in a manner that is fairly simple for consumers to understand. So certainly please take a look there. But again, as of right now, advanced premium tax credits themselves have not gone away, but they are only going to be available to people who are earning up to 400% of the federal poverty level. So going on to the next slide, I just want to acknowledge some areas or some groups of individuals who are going to be impacted. We do have a certain number of students who are in Plan Type 1, so I'm not sure if you have any students/artists that are part of your group, but just want to acknowledge that um, for students, Mass law does require them to who are enrolled in at least 75% full-time school to have health insurance that meets state and federal standards. So if someone is under 26, just a reminder that they can stay on their parents' plan. They can also enroll in student health insurance plan, also known as SHIP plans. And they can still, in fact, apply for coverage through the Health Connector. So just cautiously, though, if someone was a student, had no income at all, and they were previously enrolled in the Connector Care Plan Type 1, their Connector Care Plan Type 1, again, that coverage will end. And if they are a student and they can access SHIP, losing access to Connector Care will be and is a qualifying life event. Going on to the next slide, I want to talk a little bit about health savings accounts. This is something that the Health Connector itself does not administer. However, due to the changes in programs and changes to the landscape of the cost of the plans for 2026. For the first time next year, health savings accounts can be used with an individual plan on the Health Connectors platform, but you can purchase a bronze tier or catastrophic plan. So prior to this, people were only allowed to use a HSA account with and HSA compatible plans. Now you can do that with the HSA compatible plans as well as bronze and catastrophic plans. So basically, an HSA would be set up with an institution outside of the Health Connector. As examples, you could set this up with a bank or an organization like I'm just thinking like Fidelity Investments, etc. This lets someone take dollars, set them aside, and you can pay your out-of-pocket healthcare costs through these accounts. Um, you cannot pay the monthly premium through these accounts, but you can pay for your deductible. You can pay for your certain medical items. And it's really laid out via the IRS. So if anybody is interested in learning more about the health savings account, I would really encourage you to read through the new page on our website and also talk to anyone who may be helping you who prepares your taxes at tax time. So another opportunity for savings if you, as you're looking to coverage in 2026. So what does this translate to practically speaking? So we wanted to compare what things looked like in 2025 to what it looks like in 2026, or what it will look like in 2026. So through the end of this year, if an individual is making less than $75,300, they would have qualified for a Connector Care plan. As we look at next year, this is where it's nuanced. The range for an individual is between 15,629 through 62,600. For a family of four for this year, the income limit would be $156,000. However, for 2026, there is an income range. So you can see that it's 32,150 through 128,600. And we know that this doesn't reflect every situation that you may be in. So I want to just turn to the next slide. And talk about the plan types. And then we have one more slide that has a little bit more detail. Yes. So we'll come back to these because I know these are hard to absorb. So Lee, if you don't mind going back one step, here we go. So you can see that this is our Connector Care chart for 2026. I believe that there was a question in the chat before asking about costs for 2026. So I want to start here with Connector Care, and then I'll talk to you a little bit about where you can find other, unsubsidized plans in those costs. So to answer the question, yes, our board of directors we work very closely every single year to go through a process called seal of approval. And we work very closely with not only Health Connector staff members, but the Division of Insurance to ensure that all of the plan designs that each of the carriers submit to us meet all state and federal requirements. Um, and so because of that, we are able to let you know that there is for the plan types that remain, so plan type 2A through plan type 3C, there is between $2 and $5 shifts in cost for the lowest cost plan in that plan type. So as an example, if somebody were a plan type 3 B member, the lowest cost plan is going to be $152. However, you could choose a different carrier because you might want a different network and you can choose to pay more. And also for individuals in plan type 2A, we do have a lower cost, $0 plan, but somebody again might want to choose a different carrier because of their doctors, specialists, etc. And you would be paying a premium there. Now, I would encourage people to take a look at our resource download center, and we'll plug all of this information into the chat, but you'll also get these slides, all these links, and more, we promise. So no need to take detailed notes. Um, and you can see specifically how all of this could play out for you. So, Leah, if you don't mind going to the next slide, this is the chart that you might be saying, okay, where do I fit in? Where does my household structure fit in? Something I do want to mention while you take in this chart, because truthfully, we know that it's a lot to take in. Um, when we talk about a consumer's household, it's really anyone who is part of your tax filing household. That's what the Health Connector is interested in. And that's the information we use to determine what your tax credit will be. So, not to worry, you're going to get all of this information, but we wanted you to just kind of maybe take a moment, have a chance to see where you may fall into for next year. All right. So in this section, just wanted to remind everybody, these are just some health literacy kind of terms and also tools that the Health Connector has so that you can most effectively shop for the health coverage that you need. So when you think about health insurance coverage, I think we really just want to demystify this by saying, we've got to break this down a little bit. A lot of people, when they think about affordability, they just think about their monthly premium. But in addition to the monthly premium, which is the amount of money somebody pays each month, we want people to be thinking about the out-of-pocket costs associated with them using a service. So, for example, if somebody is picking up medication or if somebody needs to have an MRI, we want them to be thinking about whether or not the plan has a deductible. The Connector Care program does not have deductibles. However, most plans, all other health insurance plans sold through the Health Connector, do in fact have a low deductible or a high deductible. And it varies depending on the tier of coverage that the person chooses to enroll in. In terms of covered benefits, these are all the services that are covered through the plans that are sold on the marketplace. Again, Thalia mentioned this, but I just want to acknowledge that all of the plans that are available through the Health Connector meet state and federal coverage for standards, so they are comprehensive. So that's a thing in a certain way, you don't have to worry about, you don't have to think about. However, depending on your situation, if you're taking a specialty medication or you're involved in treatment, you may want to look very closely at the summary of benefits and coverage to see if that particular thing that you need is in fact covered. And then lastly, that is part of what makes um, shopping and or some cost savings available to you is the network that is available to you. So the network really is the list of doctors, specialists, hospitals, other organizations where like you get tests done or physical therapy that are contracted with a particular carrier and available through a specific plan. So these are all different levers that you can basically adjust to maybe save a little bit of money, or if depending on your own personal situation, you may make a different decision based on the amount of care that you know that you're going to need in 2026. I know everyone doesn't have a crystal ball, but because of that, we want to share a couple of the links to the tools. So the first tool, and I think somebody was asking about plan rates. The first tool is our Get an Estimate tool. And this lets you see what plans are available in your zip code And based on some very simple information, it's going to estimate what your savings may be. So if anybody's interested in playing with that right now, please feel free. You can go to our homepage at mahealthconnector.org and just enter some basic information and you can get an estimate and see what the costs, who's available in your area and what their costs are. Now, after you get that list of plans that are available to you, you probably want to and need to drill down a little bit deeper. So you want to find out if your preferred provider or a particular facility is covered through a specific plan. So you may have a relationship with a couple of doctors, but you might be thinking, I very much need to keep this specialist. I have a relationship with them. The others, not so much, right? So you have some flexibility, and you can really, without even completing an application, you can go into this plan comparison tool and see which plans your particular physician is associated with, or if it's a hospital or another practice that you want to go to, you can see kind of what your wiggle room is. And then lastly, when you're in your own online application, you can use the plan finder tool, which is basically a combination of the get an estimate and the plan comparison. But this is where you are getting your exact pricing. And really, this is the most reliable after you've completed your entire application and you have an eligibility result. This is where you really can, shop for a specific plan within a specific price range and choose the one that has all of the individuals or locations that you need to have included. In terms of billing and payment, um, we wanted to just acknowledge, we said this before, but it's good to hear it again. When you're shopping on mahealthconnector.org, sometimes people leave their plan in the shopping cart. It really is just like any other online shopping thing that we all do, right? But your enrollment isn't complete until you check out and you make your premium payment if one is owed. So, depending on when you are looking for coverage, if you need coverage for January 1, you want to pay by December 23rd, but open enrollment ends January 23rd. So, if somebody misses the boat and they are trying to get into coverage for February 1, they can still do that as long as they pay by January 23rd. And if you are, I believe if we haven't already, we will be sending out the bills for January 1 this week. So if you haven't received a bill, if you're a member and you haven't gotten a bill, don't worry, it's on its way. Once you get that bill, if it's for a premium you really weren't expecting, you can shop. And technically, you have until January 23rd to make a change. In terms of making payments, you can make payments online. You can make payments by mail, and you can also pay over the phone. And the image on the right it's just a little sample to show you if you did get a paper bill, and we encourage you to go paperless if you can, but if you get a paper bill or if you go paperless and you go to look at your invoice online, you're going to be able to see the details, like what the full premium amount is, how much of that is advanced premium tax credits. In this example, this person would be getting a connector care subsidy and so on. So we just want you to be familiar what this looks like for those of you who might not currently be members. All right, let's talk a bit about where you can get help. And then I do want to leave time for questions. We might have a chance to do a demo, but I'd rather answer your questions first and then see kind of where we're at. So we know we're used to talking about this. We know some of this may be very new for some of you. So know that, particularly now, it's December 3rd, you can get help with this process either by reaching out to our customer service center or going to a community partner. So going to the next slide, all of this help is free. So if you don't feel technically savvy, you can just simply call 877-623-6765. They'll do an application with you over the phone from start to finish. If you already have an application in the system, once you give the customer service representative permission to access your account, they can actually step through that account with you and make any updates that you need for 2026. Um, yeah, great, great. Community partners. Community partners, these are folks who are trained and certified by the Commonwealth. They are, some of them are grantees, while others work at hospitals, health centers. But they can also provide free in-person help. They also provide help over the phone. If you would prefer to make an appointment with somebody in person, we just recommend that you search for help near you and then call ahead. As you can imagine, it's getting busy and more holidays are coming up. So please do call ahead and make an appointment. They are available to help you and can help you wherever you are, whether you're at the beginning of the process or somewhere in the middle. And lastly, shine counselors. I mention this because we have usually questions about people who are currently Health Connector members but might be transitioning to um, Medicare mid-year. And Shine counselors are really skilled in all things Medicare. So we want to just kind of give a shout out to these folks because, again, you know, they're just fabulous and a great resource to have. All right. Dalia, what do you think if we take questions first and kind of see where we're at? And are pennies really going away? Kelsey, you're going to delete some of this stuff, right?
So there are a couple of questions in the chat. I think you have actually covered some of them, but would it be helpful if I read them? I mean, you also have access to the chat, Nikki and Thalia, so
Um, it's totally how do you typically handle it? We're fine reading them out loud.
yeah, that would be
And
great if you don't mind, just for folks who don't have access to the chat.
yep,
If you could read them out loud and then an answer, or we can.
yep, absolutely. Just give us 1 second. Um, what the first question I see is, are artists also able to get health insurance through freelancer unions, and how do those plans compare to plans on the Health Connector? So, in terms of the freelancer unions, I think I'm not as familiar with those. So I don't know, Emily or Kelsey, Richeline, if there's anything there that you want to just talk about.
Um, so we are not, our depth of knowledge in freelancer union health insurance coverage is not great either, but I would say I'm sure there are a couple out there and that do include artists. There's a larger conversation nationally about portable benefits, and there's been some really interesting advocacy work, largely stemming from Artists Rebuild New York, that has some interesting resources related to that question. But I don't. That's as much as I have in terms of knowledge.
Okay. Maybe one thing I will say is, if you are kind of comparing and contrasting, you can certainly come to the Health Connector. You can complete an application. There is no obligation to enroll. So you can get all the information you want and need from the Health Connector and then do a comparison. As we discussed, all of the rates for 2026 are in, and you can see that by going to the Get an Estimate tool. And if you are doing a full comparison, it would be helpful to compare any Health Connector plan that you're thinking about. There's what's called a summary of benefits and coverage. Just compare that with the summary of benefits and coverage of any other plan that you're considering. And apologies as I'm just going to pick up my little critter. Delia, if you don't mind taking the next one. I don't know if you folks can hear her.
Yeah.
I would like to make her stop.
Hello. So one of the questions is, how do you know if there are document proofs that are owed for existing members? It's very much like the same as our new members. You will receive notifications in the mail letting you know that you need to provide proof. And Nikki, I'm not sure, but I think at the end of the application as well, it will let you know if you need to submit anything.
Absolutely, yes. So once you've completed the application and you have an eligibility result, if something didn't align, it will tell you right then and there. And maybe it's worth just kind of giving all of you some background information, which is when you are going through your online application, if you enter income or you enter that you are a US citizen, what's happening as you're going through the application is your information and our application are actually we call it pinging other data sources. So if it pings the IRS or the Department of Revenue, and it's like, no, they made a lot less last year. Why are they calculating their income so high, or vice versa? Those are the types of things that trigger, um, we call them requests for information or RFIs. So hopefully that helps kind of explain a little bit of the background.
You want, Nikki, I can read the questions.
Sure,
If your
absolutely.
doctor does not take Mass Health, but you have a change in income that would likely make you eligible for Mass Health, do you have to take Mass Health or can you keep your connector care plan to keep your doctor?
This is a tough one. We hear this and it's a challenge, right? So the Health Connector and Mass Health are two separate organizations and we run or manage separate health insurance plans. We do share an integrated system, and that's what allows people more easily to update their application and move between Mass Health and the Health Connector as things happen. So unfortunately, if you are currently in a connector care program and then your income shifts, you know it's going to shift next year and you're going to be qualifying for Mass Health, you actually can't choose to stay in the health connector plan. You have to go into whichever plan you qualify for. I hope that helps. And Dalia, if there's any other way you would explain that, please feel free.
No, I think you explained it well. Is the MA Health Connector the same as HSA insurance?
So I'm fairly certain that there's a company out there called HSA, and they're a brokerage house. So if you're referring to HSA, that is a separate public organization where people can, in fact, buy plans. In this deck, I was talking about health savings accounts, which is also very, separate from the health connector. These are the rules are established by the IRS, and those accounts are essentially ways in which people can save money on health care expenses. I hope I answered that for this person, but there is a company called HSA, a brokerage house.
Can people with private insurance through a day job set up an HSA through the Health Connector?
So you can buy an HSA compatible plan through the Health Connector or a bronze or catastrophic plan and use HSA dollars to pay for some of those services, but you would set it up, you would actually set the HSA up with a financial institution.
Will the tax credits change the way insurers can decide what services are covered? For example, pre-existing conditions.
So thankfully, no. Um, there have not seen any modifications to coverage requirements and or the fact that people cannot be excluded for pre-existing conditions. So that is has not been on the table.
Are the list of covered doctors up to date? I frequently get told by doctors' offices that the information is not accurate and that they are not accepting that insurance.
So this is a challenge that we have, particularly, I think, as we get to the end of the year and it's our open enrollment. With the Health Connector displays information about all the doctors, the hospitals, anybody that they're contracting with. We get that information directly from the carriers. So if there is a specialist or a physician that you 100% think I need this person in my life, I need to double check, triple check. I recommend not necessarily even calling the doctor's office. I would call the carrier and confirm that the contract is in place, because they'll be able to tell you. And sometimes I've had the experience with clients where they say, well, I called the doctor and they said they take all the Tufts plans. And it's like, okay. Or do they take Tufts Direct? Do they take this? So if you call the carrier, you will get the most accurate information based on whatever is contractually established at that time. Um, what happens is there's a couple of week delay in the information that comes to us from the carriers, but they do regularly update that information.
Is there an income limit for using the MA Health Connector?
No, no income limit at all. The income limits we were talking about are really to see if you qualify for tax credits or qualify for connector care.
Are the estimates showing online now accurate for 2026 with the federal tax credits eliminated? Or should I be planning to pay the estimate plus the APTC?
No, so thank you for asking that question. Whatever you are seeing right now is correct. The only, hopefully, what could happen is you could end up with more savings if enhanced premium tax credits, if any of those dollars come back to the states. But this big shift really is plan type 1 is eliminated, plan type 3D. So the highest bracket and the lowest bracket have been eliminated. You can and should comfortably um, plan for that amount.
Um, it's kind of a long one. I'm trying to summarize it. So basically, if since tax seasons kind of happens in January, February, should they be reporting income from last year or this year since they're not sure how to report income?
Yep. So it's really up to you. There's some flexibility, but I think we want to talk about the pros and the cons of how you do it. So, if you are a contractor, seasonal employee, right, you're going to be making different money. As a consultant, I know that individuals pay taxes on a quarterly basis. So if you're doing that, you can take that information and use that to estimate income. When you are completing an application through our system, we're asking you to project income for the next year. So if you, let's say, you made $70,000 this year, but you have no idea what is going to happen next year. If you're anticipating that it's going to be about the same, you could say, yes, 70 for 2026. When we do our data checks, we'll go back in time. It will say, yep, looks about right. It's within a reasonable distance of what this person has made over the last several years. Great, great, great. And, it moves on. However, if you know that it's going to be different for a variety of reasons, you can estimate lower. You can estimate lower income. Um, take the savings that you need now, because if you know January, February is going to be slower for whatever reason, when income goes up or something changes, let's say March or April, you can go back into our application and just update that income. So pros and cons. I'll try to say this, and then Thalia, add in any other pro and con that you know of. Um, it's good to do that because there's flexibility for you. The pro of underestimating is at the time you need it, you're going to get more savings. If you underestimate for the whole year and you don't update your income, you need to reconcile your taxes. You have to file your taxes for the following year. You may end up owing dollars the next year if you never went in and adjusted the amount of dollars you're making. So pros and cons. So sometimes people say, well, I'm going to overestimate so that I don't take too many tax credits, and I'd rather get some tax credits at tax time. So pros and cons. Celia, thoughts on that?
I mean, that's what I would say. Just go in, honestly, just go in and make the updates. It is tedious to have to always go in and make the updates and adjust your tax credits, but it will save you a headache at the end of the year when you're filing your taxes.
How did we do, folks? Did we get to all of your questions? Is there anything else that you're thinking?
What's amazing is you answered all the questions in the chat and you like finished right on time. Um, I know that like thank you both for spending the hour with us and for answering these questions. We will make the slide deck available that you shared on our website when we also post this recording so folks can have it. Folks who are still on this call, please share this information with your networks and your communities, right? Like there's ways to get health insurance in Massachusetts, and I am really proud that I live in a state that consistently works to make sure that people have the coverage they need. And so Nikki and Talia, thank you so much for the work that you all are doing with your teams at the Health Connector. It makes a huge difference and we really appreciate it.
And we really appreciate all of you. Thank you. And please don't hesitate to reach out if you need anything. And we'll also share a link to, we're having a public webinar next Wednesday. So if there's anyone else, any friends, family, we would be happy to have you join us then.
Wonderful. Thanks all. Have great days, everyone.
Thank you.
Everyone.